Now to a big health alert about the Zika virus. Top government health officials sounding the alarm this morning, saying the virus is, quote, scarier than they thought and could spread through more of the U.S. than previously believed. They initially thought 12 states were at risk, but now that number growing to 30 and fears it could rise as the temperature heats up. Here's what officials had to say.
Everything we look at with this virus seems to be a bit scarier than we initially thought.
The more and more we learn, the more and more you get concerned about the scope of what this virus is doing.
Joining us now with more is ABC's chief women's health correspondent, Dr. Jen Ashton. I know you're very concerned about this. When you hear top health officials using a word like scarier, what's the growing concern here?
Well, I mean, first of all, there are more questions than answers at this time, Robin. As you heard, the cases in the U.S. are up, although that is still now associated with travel. Summer is coming. There are 4 million babies born in this country every year, so the potential for a lot of people to be affected by this is there. And for the country's top doctors to use this kind of language is very significant.
We've heard about the small brain size, but what more are we learning?
Well, we know that Zika can affect all stages in pregnancy. We think that it also affects the placenta, can affect stillbirth, miscarriage, pregnancy loss, and of course affect the central nervous system. This looks like a very bad actor.
And what are you telling your patients?
Well, listen, I have several pregnant patients right now in their first trimester. I'm telling them control the things that you can control. If you can delay or avoid going to the Caribbean right now, do so. And then it's all about minimizing exposure, maximizing prevention, especially as we get into the summer months. Cover up and use that mosquito repellent.
As you said, summer's just about here.
This is concerning to obstetricians, women, pregnant people, everyone in the country.
All right, Jim. Thank you.
You got to keep an eye on this one.